Good afternoon, Hattiesburg. Thanks for joining us for this afternoon's briefing. We're going to go over several things today. First, we're going to go over the test results. For today, we're also going to talk about a little bit more deeply about the reduction in force that the city is currently going through. We will also talk about a new mask requirement that's coming for the month of May. We'll talk about some non-COVID related city news that's very positive, and of course, we'll do our regular active courage. So today's numbers, again, these are system-wide for our healthcare organizations. So all of Forest General's 19 counties, all of Merit Health Wesley's 18, Semri, and Hattiesburg Clinic. So as of today, we've had 5,249 total tests done for COVID. 619 of those have come back positive. Of course, those are not just in Forest and Lamar counties. In fact, what we are seeing in recent days, even though we're kind of staying at a certain threshold, we're seeing more tests at some of our healthcare organizations come back positive, which just shows that this is a regional problem, and because that regional problem affects our two healthcare institutions. 4,290 have come back negative. We have 341 tests that are pending as of today. Our two goals in all of this are protecting vulnerable populations, that's people who are over 60, people who have underlying healthcare conditions. We also want to prevent overrun of the healthcare system by slowing the spread, which we have done a reasonably good job of up until now. Right now we have 35 people in the hospital for COVID. That's about what we've seen average over the last 14 days, and that's actually down a few from our last briefing on Monday, so that's a positive thing. Our ICU admissions, these are the most acute COVID-related, COVID-positive patients. They require certain equipment, they require specialized care. We now have 14 people who are COVID positive in our ICUs. Most of these are at Forest General, but what this shows is that both of our ICUs, whether Merit Health or Wesley, are still having to deal with car accidents and strokes and heart attacks. So this does put a strain on their ICU capacity. We are a little bit higher than the average over the last 14 days. The totals per county today, Forest County jumped by 2. They're up to 198. Lamar County jumped by 8. They're now at 102. For the entire metro area, we're at an even 300. But let's look at the 5-day average. Again, this is taking the day of, the 2 days prior, and the 2 days after. And again, we see this peak around the middle of April. We saw a nice decrease, but then we kind of went back up at the end of last week. We have seen a little bit of a drop this week, which is very positive. Lamar County's kind of took an upward tilt there at the end because that reflects the 8 new positive cases today. What we're hoping is these numbers will stabilize and we'll start to see that 14-day trajectory go down, which is part of the requirements issued by the White House before we can issue any sort of reopening protocol. But the big thing we have to be mindful of is local data. We're going to look at 5-day averages. We're going to look at hospitalizations, ICU admissions, because they're criteria that the White House has given us, and we'll show you that right now. Of symptoms, of cases, whether testing positive or percentage of total tests coming back positive. We're also seeing what's going on in our hospitals too, and all these things combined let us know whether it's time for us to go on to the next phase of reopening. So switching gears for just a second, I want to talk a little bit more about the reduction in force that we announced on Monday. And we talked a little bit about what was going on with March sales tax revenues and why that reduction in force was necessary, but I want to kind of take you a little bit deeper and kind of show you how city budgeting works when it comes to sales tax. So on the left, you see the sales tax revenues that came in during fiscal year 19, which of course our fiscal years run from October 1 to September 30th. On the right column, you see everything so far in FY19. One thing to know about this, so if you look at March of 20, that actually reflects the January sales, but we don't get the payment until March 20th of March of 20. And so well, the number we were made aware of by the Department of Revenue is actually the May 20 slot, because we'll be paid May 15th the sales tax that came from March. So that May payment, as of a couple of days ago, is looking like $1.763 million. Again, that reflects March when we were shut down for about half the month at the most. That represents a 15% decrease in sales tax revenue for, again, the month of March that we'll receive in May. And you can see last year in that same month period, it was over $2 million. And so a little over $300,000 right now just for that 1 month. So when we think about the June payment that we'll receive, which will reflect April's actual sales, keep in mind that almost all of April we were under shelter in place by the governor, so you can almost take that half a month from March and double that 15% to 30%, and that's what we're forecasting will be short. But we'll show you kind of this on a bar graph here. You can kind of see that up until now, up until the May payment, we were either slightly above, slightly below, but coming a little bit ahead. May, that number dropped, and then we anticipate for June, July, and August payments, which actually reflect April, May, and June sales, that separation is going to extend to about 30%. So that's what we're preparing for. We do hope that when we get to September's payment, which will reflect July, that things will be opening up just a little bit more, that there might be a little bit more travel as people get used to the idea of wearing masks and going about their lives again. But at the same time, we have to budget for worst case scenarios. And so when you add all this together, we're forecasting as much as $2.2 million that we will lose between the March sales, which again, we'll get that payment in May, all the way through the end of the fiscal year, which is September, which reflects July sales. When you added that to the fact that the city has been carrying a structural deficit for the last 10 years, and we have trimmed the structural deficit down to $2.47 million. And when I say structural deficit, I mean budgeting more in expenses than you're actually going to take in revenue. And again, we've been able to trim that down to $2.47 million. But when you factor that in, and you factor in the gap in sales tax, the potential overall deficit of spending reduction we may have to make is $4.7 million. Now, do I think that we'll get there? Probably not in terms of $4.7 million. But we have to again plan for potential worst case scenarios. This won't all be absorbed through the reduction in force. That $4.7 million may come from cutting part of the paving budget out of our general fund. It may come out of not hiring as many folks, like in police and fire. We typically don't fill all those positions anyway. That's going to help. But that $4.7 million, we looked at several scenarios on how best to tackle a large portion of that. And we looked at, what if we cut pay across the board 15%? We looked at, what if we took everybody to 30 hours? What if we just deleted open positions? And really nothing gets us to a point where we're comfortable enough thinking that we could cover most of that gap there. So again, this crisis has challenged us all, and this decision is incredibly painful because we're at the city, we're kind of one big family. But we have to take steps while providing city services to maintain a balanced budget and a responsible fiscal position, because this thing may not end in this fiscal year. It may that revenue also may carry the next year. We have to kind of think about what are some sustainable ways that we can set ourselves up to not have to do this again for a second and third round. By doing this now, we actually also allow us to recoup some of those numbers that we just looked at, and also, but most importantly, by doing this now, we give our employees access to enhanced unemployment benefits going forward. And so, again, a very tough time for folks and for the city to make this decision. But we're doing it in the best interest of the city as a whole, understanding that that we're kind of in uncharted territory right now. We're forecasting out several months of what losses could be, and we're doing the best we can in trying to navigate those uncertain waters. One thing that we've talked about in recent weeks are masks. Of course, last month we issued an order that if you're going to be out of the store, the employees must be wearing masks. That if employees are around other essential employees or non-essential employees, they had to have masks on. Coming May 1st, masks will be required not only for employees but also customers at these retail stores, whether they're essential retail or non-essential retail, as things begin to potentially open back up. And again, we take a lot of that guidance from the governor, but we also look at our own local data. The majority of you are already wearing masks when you go out to shop at grocery stores and pick up food, but that will be required for everyone in the month of May. And so, again, a mask is not necessarily an N95 or a surgical mask. It can be a cloth mask. It can be a handkerchief or a bandana. The whole idea of a mask, though, is it covers your nose and mouth while allowing you to comfortably breathe. And the benefit of a mask is if everyone wears them, we protect each other. And if we're going to get back to some semblance of normalcy, even though I don't think any of us know what the new normal is, but if you want to see commerce continue to open back up, if we want to get to the point of the conversation, we're talking about salons and we're talking about church again, masks are going to be part of the equation. And I think we need to prepare that's going to be part of our lives for the next few weeks and potentially months. So if you go into a public space where other people are gathered, wear a mask. This is going to be a requirement at stores going forward. Some good news that's non-COVID related. If you live in the Pine Hills neighborhood, or if you live McKenna Loop, or if you live in Innswood, we had a positive development today. We opened the bridge on South 28th Avenue. This was the one of the city's worst rated bridges. We stepped forward, and the city was able to replace that bridge beginning late last year, and we actually finished it in April like we said we were going to, just in time, and we were very appreciative of the contractor who had some tough weather the first part of the year to work in, and he and his crew were able to get that done. So today we joined with Neighborhood Association members. We joined Councilman Nick Brown in Ward 5, who has the west side of South 28th Avenue, or has the east side of South 28th Avenue, and Councilman Carter Carroll in Ward 3, who has the west side of South 28th Avenue, to officially open this bridge. So you guys can now go to and from wherever you're going in that area. Our acts of courage, we have two of these today. The first, which is a friend of mine. Debbie McKee was a classmate of mine a couple of years ago when we were in our healthcare leadership program. She works at Cigna Medicare. She is based out of upstate New York, but she's the Southeast regional manager for that. And when I told her some of the struggles we were having and the need for PPE and the need and the desire to get our most vulnerable populations some masks, she actually donated $2,500 from Cigna Medicare. They have a branch here in Hattiesburg too, and we appreciate their Hattiesburg team and Debbie looking out for our citizens like that, and glad to make that connection and bring that donation to Hattiesburg. The other folks who want to recognize are Chick-fil-A. Chick-fil-A donated 5 million pounds of food to Christian Services and to Edward Street Fellowship, and this is a really big deal because during times like these, the demand on food pantries and food services goes way up, and so to have our private sector step up to the plate and our faith-based community already to meet this need, we appreciate it. So thank you, Chick-fil-A. And finally, as we go in and end up this Wednesday, going into the rest of the week, again, remember to wash your hands, take care of yourself physically, mentally, wear a mask if you go out in public. Again, this will be a requirement for stores on Friday. Do only what is essential and stay home. Courage.